dorsiflexion, because you can see that your actual amount of dorsiflexion is pretty good. All right, let's get Hunter Killer in here. HK. Nice. Okay, so we'll go with that. Yep, perfect. Okay, so we saw your basic range right there. You can also have the person take a gait, so just walk for a little bit. See how everything feels. Okay, perfect. We're going to have you lay face down on the table, socks off with your ankles slightly off the edge of the table. And I think that if you get nothing else from today's course, this will be the treatment that you will take home and use with you every patient starting on Monday. Okay, or Tuesday or Wednesday, whenever your practice actually starts. So what are the units you guys use? All right. Okay, so a couple of things. Number one, we'll actually get you down even a little bit further if we can. Yeah, right about there is perfect. So a couple of things. What do we do to start with? We did our range of motion assessment. Now what do we do? Butter, right? We back butter. Or you could go ahead and do your basics first. Oh, what am I doing? Okay. What are you going to do? You're going to go ahead and start off, spread your lotion around. I like to use this on people, like even though you want to be pretty, people don't pay attention to their feet, to their heels. Put a little bit of lotion on that. Hydrate that skin over top of it. Right? This is going to be a win. Okay? So all of that's going to happen. Go ahead and just find some range where you want to work a little bit more. Not too bad, actually. Usually if this Achilles tendonitis or something, or even Achilles tendon ruptures, potentially you can see some benefit there, but all right. Okay, so basic treatment. First stroke is discovery stroke. You have a couple of options. We're going to use this stroke later in the forearm, but all I'm doing is literally putting this in the palm of my hand, putting my thumb over top, and watch this magic. Putting it on the patient, okay? And then from here, you can just stroke through, and you can decide, do I want to hook in more with the thumb edge? Do I want to give more of the spoon edge right there? Either one of those is going to be fine. You can work through that tissue. And you'll ask your patient, if anything's too much, please let me know right away. And we can kind of work through there. And just simple movements like this, okay? So that'll be one that you guys can start with. Looks really easy. Once you get it, this will be the same hold that you're going to use in the forearm. But for most of you, this initially will feel easier. Why is this easier for everybody? Because this is the knife right here. Everybody's used to working with a knife, so it's not a big deal for you. So you can do the same thing here. I'm still seeing some of you use this. Can everybody see how I'm moving like that? That seems natural to begin with. I'm going to encourage this wider spread out grip right here, okay? Working your way through, same kind of thing. These actually aren't too bad. I felt way worse than this, but that's okay. Maybe a little bit right through there. Okay? So from here, maybe I want to go into the plantar fascia. So you started to loosen up the gastroc and soleus a little bit. Maybe you want to increase your dose a little bit here. Sometimes you got to watch people because they'll actually be jumping off the table, but he's doing pretty good. All the way through here, coming down through Achilles. All right. So why do I like this setup? Because now I can use my knee to actually put him in a little bit of dorsiflexion this way. External rotation like no tomorrow here. Switch legs actually. All right. Now, all the way from Kelowna, we got the Dr. Mike Tassoni special. This edge right here is a little bit sharper, and it fits exactly into the groove of most arches. Yeah, all right. So right here, I'm going to hold the front of his foot so he can't get away. All right, see how he's locked in right there? There's no escape now. And all I'm going to do is just run up nice and lightly through the foot. This is actually pretty good. Okay. Usually, even with this pressure, people will be jumping off the table, but he's doing great. So I've got 2 points of force. One is my hand pushing forward like that. The other one is my other arm pushing in at the same time. And you can go ahead and work relatively deep. And let's ask our patient, how does that feel?
It hurts so good.
Hurts so good. Take it. I can take it.
Oh yeah, good.
Yep. Okay.
We
But
believe
it,
you.
like,
Yeah.
it's not pain, but it's not tickling. It's kind of that in between.
Yep.
Either here or there.
This is the one that really, like in some of you, you're going to be able to do this, and you're actually going to hear the person like grr, 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 as you grind through it. Okay, so just be aware of that. Even if you listen closely here, if the fans aren't too loud in the room. Yeah, you can kind of hear it. But anyways, so you can work up like that, give a few passes through there, and actually you're taking this like a chin. I got people who usually just jumping off the table by this much pressure, so this is great. Okay, the next thing that you can do is you can continue this up. I'm going to take the smaller arches here, yeah, and keep on running up all the way through the Achilles tendon. Or I'm going to introduce this option to you now. We'll talk more about it tomorrow. This fits perfectly around these Achilles tendons, and you can even slide underneath and work your way back and forth like that, okay? And we'll do this into the forearm as well, but it's a nice way for you to actually trace the outline of the Achilles tendon from gastroc soleus coming down. So you can do the same thing here. I'm using two hands against two hands just to stabilize like this and roll my way through that tissue. And I can actually get and even lift up just away right there. Okay? And I have done this before where I've actually punctured it all the way through and lifted it. Okay? Right? You will not do that, of course. But you can work ultra specific with it. So that'll be a basic starting point for you right there. Flushing out.
Sorry.
Yep.
Sorry, what are you trying to address when you're doing that hook?
If you're hooking in, it's a way for you to access the anterior side of the Achilles tendon. Like, it's pretty hard for you to actually get in there with your fingertips and get in there. So here you can actually give direct stimulation over top of that tissue.
The tendon, like you're addressing tendon?
Yeah, totally. Tendons have more than one side, so I want to get around them as much as possible, right? So, okay. All right, if we can have you go ahead and flip over, we can do a couple of other things right there too. So all of this can also happen on the front. And I'm just going to stay on the one side here as well. You really want to, there's this hard, most people I find have these pretty major trigger points all the way up the medial side of their leg right here. It's like, it just feels like this one big trigger point. Oh no, that's the tibia, right? Okay. So you probably don't want to be ultra hard over top of the tibia, is what I'm trying to say right here. So if you can, have the person internally rotate or even lay on their side just the littlest bit, like a 3/4 side. Yep, there you go, perfect. This is going to give you good access over the lateral side. And I think there's enough oil left on the tool and this hand right here that we can just use that. You can do the same thing running up and down the front here if you're looking at compartment issues or anything like this that you want to work through. So tibialis anterior, extensor digitorum longus and brevis, same kind of stroking that we've seen before. You can take it all the way down. As you get over top of the tendons, you definitely have to be lighter. I had one triathlete. He actually came in 49th at the last Whistler Triathlon, which is pretty amazing. And he was having issues because he couldn't fully plantar flex his ankles, so he was having trouble getting his swimming stroke and everything like that up. So we actually did a treatment with him loaded in and working through the front of his ankles like this. So you have options where you can work on that. Again, working relatively light. And some people will respond well to this. They like it when you go ahead and treat around their toes and even in between their toes. Okay? Some people don't, some people do. Okay? We have all of this available for you to work on as well. Even small treatments over here. We'll see these are more relevant, especially for us into the hands as therapists, but those are options that you have. So explore your way around the distal part of the leg right. Okay? Go ahead and get up and just walk around and you can do the squat again for us, actually. Okay? Okay?
Yeah, definitely feel more.
Yeah. So number one, you have your patient get up and walk around. They're going to say it feels looser. Even their arches might drop in a little bit better. Yeah, like even that motion, so you can see how much more fluid it was on the other side. Right?
Versus the outside detail.
Yep. And then even just give us the full squat again if you want.
Yeah. Oh, yeah, that's better. Still gonna fall back, but
Yeah.
since it wasn't bilateral. Nice.
Yep. Okay. So that's your basic right there. Pitter patter. Let's get at her.